Hi, good evening everyone. So, welcome to the pre-recorded lecture. Now, I'm going to get straight to it. The topic is correlating histological structure with physiological function for a better understanding of microanatomy. Okay? Now, the most important question that a lot of students ask me is, sir, there's already gross anatomy to do, there's neuroanatomy, there's embryology. We don't really get enough time for histology. And I completely relate with that. If you've really been attending your histology practicals and you've paid attention and you've been very serious about completing your journals on time, which is a very rare phenomenon, by the way, then the overall pressure is really less when the exams come as close as they are right now for you guys. So, one of the best ways of dealing with this crisis is something that I refer to as fast reading. Now, you can't really expect to be reading extremely slow when you are at this stage, correct? So I would like to assume that you at least read 60 to 70% of the textbook at least once whenever it was being taught. Okay, if you just showed up for this talk right now, I don't think you're going to take home a lot of points with you. But if you've been somebody who's an average student when it comes to attendance and paying attention, then you would probably understand what I'm talking about. This is a very informal lecture. It's not going to be bombarding you with actual information. What I'm going to talk about is just a perspective of understanding a few topics and applying the knowledge that you earn in some other topics. Okay? Uh, what you can see here is on the left side is a special stain, and you don't usually see it in your classrooms. It's called the Mason's trichrome, and what it has been used for is the glomerulus, and you can see a couple of renal tubules by this side. Okay, and on the right side what you see is a physiological schematic diagram of the same, where you can see a glomerulus, you can see the Bowman's capsule, the parietal and the visceral layer. And what the physiological studies of glomerulus would suggest is that it is a tissue where exchange takes place, right? So, if you understand that wherever simple exchanges, when I say simple, I'm speaking more of diffusion, no active processes involved, wherever simple exchanges take place, the epithelium is usually squamous and flat. Okay? Another example that comes to mind is the loop of Henle, and another one is lung alveoli. Okay? So, let's keep that at the back of our mind and progress further. The aims and objectives today are, we're going to have a holistic approach to the knowledge of microanatomy. When I say holistic approach, the lecture is not going to deal with multiple points that you have to mug up and remember. It's going to give you a basic wisdom about how to approach a certain kind of tissue when you're studying it, and how knowing a little bit about what the function of that tissue is gives you an insight into why the structure would be in a certain way. I'm going to start off by talking about the tissues in the human body. It's just going to be a quick recap. Literally, I'm going to be reading out of the index of your histology textbook. Then I'm going to speak about the organ systems in the human body. Then we get to the main part of the lecture, and that is the structure function correlation. And I'm just going to use 4 examples. I'm going to use the example of a proximal convoluted tubule cell, describe in detail its structure and why the structure is the way it is, and that is because of its function. Then I'm going to speak of an exocrine gland. Chiefly I'm going to speak about the salivary glands. Then we could probably just get into the differences between mucus and serous, but that's not really the crux of the topic. Then I'm going to speak a little bit about an endocrine gland, and the example I'm going to use is the islets of Langerhans. And finally I'm going to speak about a general schema of the gastrointestinal tract and how the structure has subtle changes according to the function of that part of the gastrointestinal tract. I was also going to speak about thymus, but when I did a rough demo, I realized that we are not having enough time for thymus, so I decided not to speak about thymus. It's a very interesting topic, and if you guys love this lecture and if it kind of makes you feel like you want more, then I could definitely deal into some of your favorite subjects that you want a video on. But again, I can't promise if they would be coming out before your exams because I'm occupied with a lot of other things. So eventually I'm just going to summarize everything. Okay, so let's go ahead. Before I even start, I'm going to get a little philosophical and talk about the difference between knowledge and information. Just take a screenshot. I'm not going to read this out, but the last line really hits home. We have access and can find information about anything, but a huge amount of information available to us doesn't make us more knowledgeable. And the reason why I say this is that you could have a lot of information stored in your head by repetition and constant mugging, and that's a good thing. I'm not saying it's a bad thing, it's great. But if you cannot apply what you learn, if you cannot associate one region of your brain with another, then it's not really going to be as useful. In my humble opinion, the definition of intelligence is to associate two different things together and make some sense out of it in the least possible time. So, this lecture is going to help you in applying perspective and hopefully make you a little more knowledgeable after you read what I tell you to read after the lecture. Okay, so I'm gonna tell you to read a lot of things, not exactly a lot of things as in bulk, but I want you to go through many topics as soon as this lecture is over. Maybe it'll take 2 hours for you to quickly just read little paragraphs here and there, assuming that you've already read them at least once. Okay, so I'm gonna wait here for a moment. If you haven't already, please take a pen or a pencil, take a paper. Okay, every time I say write this down, write it down. Just add a question mark to it, and once the lecture is over, open your textbooks and start reading and finding out the answers. Okay, the whole point of this lecture is not to teach you, but to inculcate amongst you a sense of curiosity to want to know more about histology. Okay, so tissues in the human body. I'm sure you all know that tissues are actually a bunch of cells that have gathered together to perform a specialized or a common function. The first thing that you study in the academic year is epithelium and glands. I'm not going to get into the definition of epithelium, but you basically know that it lines the surfaces, right? Lines surfaces and it lines the internal tubular structures, the luminal aspect of things. Okay, so this is a very basic classification, and the reason why I just got this table here is that I'm going to speak a little bit about every epithelium and just tell you one example of each, and hopefully you can identify some other examples. Okay, squamous epithelium we already went through in the beginning of the presentation. Flat, most commonly seen in, as I said, glomerulus, yes, lung alveoli, yes, and of course endothelium of blood vessels, right? And mesothelium that lines the body cavities, which is essentially the visceral peritoneum. Then we've got cuboidal, right? Cuboidal. Now, the height of a cuboidal cell may vary depending upon whether there is any secretory function associated with it. For example, in the follicular cell of the thyroid gland, if the thyroid is actively in an active state, basically, then it becomes a tall cuboidal or a low columnar cell. But in a resting thyroid, it becomes low cuboidal, right? In certain other examples, such as ducts of exocrine glands. Now here, the cuboidal epithelium is just serving the purpose of lining a tube so that the secretions that are passing through it can go from one end to the other. So here, it's not really actively synthesizing a lot. What you do need to remember though is that, especially in exocrine glands, as the ductular system or the tubular system starts getting bigger, the cuboidal cells start forming multiple layers. So larger ducts such as lobar and interlobar ducts are usually stratified cuboidal, while the smaller ones like the intralobular duct will be simple cuboidal. Okay, then columnar Now this is a typical columnar cell without specialization, but mostly we have these examples of specializations. For example, a pseudo-stratified ciliated columnar epithelium is a hallmark feature of the respiratory epithelium, right? Why pseudo? Because the nuclei are at multiple levels, and in the respiratory tree especially, there are small little cells at the base that are known as basal stem cells. And these act as stem cells and can eventually give rise to the newer cells, which might turn out to form one of the other variants here. So the overall pseudo appearance is because the nuclei are at multiple levels because of this situation, and of course the cilia help in what is known as mucociliary clearance, right? Then secretory tall columnar cells sometimes have modifications, like what you see here is a goblet cell where the mucopolysaccharides that are formed are bulky, so they eventually lead to the formation of a goblet. And then you have a typical absorptive enterocyte or a cell of the small intestine where the apical aspect is thrown into folds to increase the surface area of absorption, which is known as microvilli. You also see this in the gallbladder. Okay. In stratified squamous, you have non-keratinizing, which can be seen lining the inner surfaces of esophagus, anal canal, and the keratinizing variety, which is seen in the cases of thick and thin skin. Then stratified cuboidal and stratified columnar, like I said, would be seen in the larger dots. And finally, the most important epithelium for examiners, transitional epithelium or uroepithelium. See what's happening here? The topmost cells are not flattened like stratified squamous, but in fact they are bigger. These are known as umbrella cells, and another hallmark feature of these cells is polyploidy. And transitional epithelium is known for two things. First, its ability to stretch, and secondly, it has tight junctions or desmosomes, and that is a modification so that the things that lie within the lumen of urinary tubules, which contains toxins, need not seep out on the other side. So the tight junctions basically prevent an leaking of whatever lies inside. So there is absolutely no reabsorption happening here. Okay, so that's one of the important features of transitional epithelium. So here's a couple of things I want you to find out as soon as the lecture is over. A, examples of each of these types. Just write them down. Alright. Then one of the most commonly asked questions is, what are the characteristic features of transitional epithelium? Come up with at least 4 points. Okay, very commonly asked question in the practical viva. Okay. Now, these are the other kinds of tissues, but I'm not going to get into the details of that. Okay, connective tissue connects one kind of tissue to the other. Now you'll see connective tissue broadly classified into loose areolar and dense connective. In loose areolar, everything is lying loosely, while in dense it has a more systematic pattern in which it is arranged. So the former would lead to a slight flexibility for the two types of tissues that it's connecting. An example is lamina propria. So lamina propria is, as you know, the layer just lying under the lining epithelium of the gastrointestinal tract, and the lamina propria is rich in capillaries, but because it is not densely arranged, there is a slight amount of flexibility that the lining epithelium enjoys. Okay. On the contrary, dense connective tissue that is seen in things such as aponeurosis and tendon are actually arranged in a specific way to create characteristic strength and stability to the tissues to which it connects, right? And when it comes to connective tissues, you also need to read a little bit more about cells. So here's a couple of cells that I want you to read about. Read about the fibroblast, read about the adipocyte. Then in the intercellular substance, I want you to read about all the three types of fibers: collagen, elastin, and reticulin. Try to understand collagen is mostly used for its tensile strength, elastin of course for its elasticity, and reticulin is a very interesting kind of connective tissue fiber which is predominantly seen in lymphoid organs. Okay. Then of course there's intercellular substance which contains proteoglycans and glycosaminoglycans. That's more of a biochemistry topic. Do read about it though, because a lot of specializations that take place in connective tissue are actually because of specializations in the intercellular substance. For example, in cartilage, there is more water holding capacity in the ground substance. In bone, there is mineralization that occurs in the intercellular substance, so on and so forth. Okay, blood is a physiology topic. Lymphatic tissue is a completely separate lecture. I'm not even going to think about talking about it today. Same for muscle and nervous tissue. Muscle tissue characterized for the act of contraction. So I want you to read a little bit about actin and myosin. Write this down. Actin myosin coupling. The teacher usually tells you to draw that diagram, so please draw that block diagram with actin and myosin and how, because you might think that you know how to draw it, but when you actually start drawing it in front of the teacher, you might end up making a few mistakes. You don't want to do that because it's an easy slide. You don't want to not be able to draw a typical muscle tissue, the sarcomere, the Z disc, all that. Please read about it. It's very important. Now, nervous tissue is again something that I would not like to talk about at all today, but please read it also from the initial part of your neuroanatomy textbook, because a lot of things in nervous histology would eventually also go to a neuroanatomy viva, like what are microglial cells, what are astrocytes. Okay, are you writing these things down? Please do. Okay. Now, all the organ systems in the human body are essentially a beautiful mix and match of all the tissues that we study. So after you're done with your general histology, and if it's really good, you can start applying all these different tissues and how they coalesce together to form an organ and how each of these contribute to the functions of the organ, right? For example, skin, the epithelium is stratified squamous, but if you see, it has the epidermis has 5 layers, and all these 5 layers show a slight change in morphology of the cell, right? So I have a slide of epidermis which I want to show to you. It's a very commonly asked question. Next, in the cardiovascular system, again, there's going to be the endothelial lining, below which there's going to be subendothelial connective tissue, also known as the lamina propria. Then we've got the muscle tissue, and the muscle tissue is so important in defining the artery. Suppose it's a muscular artery, there'll be more smooth muscle fibers in the muscle layer. In an elastic artery, there's going to be more elastin fibers in the tunica media. Okay, so that is how you can now start applying these individual tissues and how they make a difference in the overall structure of an organ system. Gastrointestinal system, what a beautiful combination of most of the tissues that you study in general. First, you've got your lining epithelium, which will be different in different parts of the gastrointestinal tract, as we shall discuss ahead. Then the lamina propria, then the submucosa. Submucosa is a little more dense, so it's not exactly loose areolar tissue. There's a certain arrangement of the fibers, connective tissue fibers, to form a more solid structure. Then also we have so many glands. Some of the glands will be smaller in the lamina propria, some will be bigger glands in the submucosa. Esophagus, write this down. Esophagus, for example, is a structure where the glands extend all the way down into the submucosal level. Then we've got muscularis mucosa, and we've also got muscularis externa, which is again muscle tissue. There's a circular layer outside which there's a longitudinal layer. The circular layer usually helps in mixing, local mixing and churning, while the longitudinal layer helps in the wave of peristalsis propagated from the oral end to the anal end. Okay, then respiratory system, once again, the epithelium is pseudostratified, columnar ciliated epithelium. You have the basal stem cells, and a very interesting observation with the respiratory epithelium is as you start descending or going from the larynx to the alveolus in the bronchial tree, the epithelium starts becoming shorter until it becomes completely squamous at the level of the lung alveoli where actual gaseous exchange takes place, correct? Similarly, the muscle layer of the respiratory tree also starts becoming thinner and thinner and thinner until it completely disappears at the alveolus stage. Okay? Urinary system, another topic for another day, but do remember transitional epithelium, very commonly asked. Below transitional epithelium, you're going to have a little bit of lamina propria, and once again the muscle system, where there's going to be a circular layer and there's going to be a longitudinal layer. Of course, when you study kidney histology in particular, that time there's a couple of interesting things, out of which I already discussed a little bit about glomerulus, uh, but there's also the proximal convoluted tubule, which I'm going to speak a little bit about as an example of specialization in a cell. Okay, then we have the reproductive system, the endocrine system. In the endocrine system, I have one example of the pancreas, the islets of Langerhans, which is the endocrine part of the pancreas, which I'm going to speak a little bit about. Central nervous system, organs that perceive special senses. So these are all the organ systems that you should be familiar with. I think that in special senses, retina and cornea are extremely important, and they are something that does need a lot of mugging up. So good luck with that.